According to the Mental Health Association in Delaware, mental illness is a major public health problem, with 1 in 5 Americans experiencing depression or anxiety disorders every year. This means more than 100,000 Delawareans, including children, are affected by these illnesses annually. Depression, if left untreated, is as costly to the American economy as heart disease or AIDS. According to the National Institute of Mental Health, the annual cost of depression in the United States is estimated to be $43.7 billion in loss of productivity, absenteeism, treatment costs, and mortality. The Mental Health Association in Delaware, MHA, is a statewide nonprofit organization. MHA provides services throughout Delaware and focuses on education, support, and advocacy for mental health issues. Today, I will share a 3-part conversation about mental illness, suicide awareness, substance use disorder with 3 individuals who have battled and overcame. Meet Karen Dinardo, Director of Peer Training Services and Outreach at Mental Health Association, Delaware.
The Mental Health Association primarily does overall training, like suicide prevention training, any type of training. We run support groups, depression support groups for males, females, groups together, male and females together in the community throughout the state of Delaware. We have events just bringing about mental health awareness throughout the entire community.
Prior to working at MHA, Karen faced her own battle with depression.
I had had numerous back operations. To make a long story short, I had been out of work because of numerous operations and subsequent damage because of that, and told I'd never work again. So what ended up happening was I went from this lucrative career, being very active and socially active, to absolutely having nothing to do, and I became depressed about it. And there were times where I didn't want to get up and take a shower. I didn't want to even get up out of bed.
Karen believes depression not only affected her, but the people around her.
They couldn't stand it because I went from being this vivacious personality to really being out of it, being very isolated and not wanting to do anything, and just being focused on my pain and my sadness of losing everything. So had they not tried to fight for me, I'm not so sure that I'd be where I am today.
Mental illness, like any other disease, comes with a certain stigma. Karen says everyone has a story.
They're not wanting to be in the circumstances that they're in. If they truly had a choice, do you think that they would choose to be on the street shooting up heroin? Do you think that they choose to be in the Delaware Psychiatric Center, having to live with all these people that they don't know? Everyone has a story. They've been through abuse. They've been through trauma. They have, disorders in their brain that prevents them from being like most people, or what people perceive as what they should be. So I think if most of us could just listen to other people's stories, I think stigma would probably decrease.
Like any other illness left untreated, it can cause an array of health problems. If you need help or looking for some resources to help someone you know, please contact the Mental Health Association at 302-654-6833.